result in most cases is an early sense of fullness combined with a sense of satisfaction that reduces the desire to eat. The amount of weight loss you can expect, as well as risks and complications, will vary for each of the procedures we have just discussed. The decision as to which procedure you have is one that must be made in consultation with your physician and your bariatric surgeon. Each of the procedures we have just described can be performed as an open procedure or as a minimally invasive or laparoscopic surgical procedure.
Open versus laparoscopic is important in the abdominal wall. That's really all that's important from a technical standpoint, because the operation on the inside should be essentially the same. So it's a big operation on the inside with the small incisions of a laparoscope or a bigger incision of an open operation.
A laparoscopic operation is performed with a small video camera, which surgeons use to view the procedure on a video monitor. The camera and surgical instruments are usually inserted through small incisions made in the abdominal wall. This approach is considered less invasive because it replaces the need for one long incision to open the abdomen.
We found throughout the last 10 years of performing laparoscopic operations that there's less morbidity for the patients. Patients bounce back from the operation done laparoscopically faster generally. They have less immunologic changes, and they have certainly less incisional hernias.
They recover faster, they get out of the hospital faster. Typically they're able to go back to work, particularly strenuous type of physical work, within a much shorter period of time than if they have a big incision.
It is important to remember that laparoscopic procedures achieve results similar to open counterparts, producing similar loss of excess weight and similar reduction of obesity-related health conditions.
Anytime you have major abdominal surgery, you run the risk of death. That's a very, very small number. Although if it were you, it would be significant. That small number is somewhere around 0.5%. Very small numbers. It's the same exact number actually if you were having your gallbladder taken out. So major abdominal surgery is a risk, not gastric bypass is the risk. And that's really important to point out.
Weight loss surgery is major surgery, and as such, presents the same risks associated with any other surgical procedure. These may include, but are not limited to, nausea, vomiting, diarrhea, temporary hair loss, bleeding, incisional hernia, staple site leakage, stoma obstruction or stricture, bowel obstruction, injury to spleen, embolism or blood clot, postoperative depression. Aside from these general surgical risks and complications, there are other postoperative risks unique to weight loss surgery. In general, weight loss surgery involving malabsorption or bypass presents the risk of poor nutrient absorption, which can lead to vitamin and mineral deficiencies for patients who do not follow a course of lifelong monitoring and vitamin supplementation. Vitamin supplementing can help avoid such conditions as protein malnutrition, anemia, and bone disease. Dumping syndrome is a condition caused when sugar is consumed in concentrated amounts in such foods as ice cream or maple sugar syrup, and enters into the small intestines before being fully processed by the stomach. While generally not considered to be a serious risk to your health, the results can be extremely unpleasant and can include nausea, weakness, sweating, faintness, and on occasion, diarrhea after eating.
It's high-risk surgery. These are challenging patients, but we have to compare the risk of surgery against the risk of them staying morbidly obese for the rest of their lives, which is very significant.
How much excess weight can you expect to lose from weight loss surgery? There are many factors to consider, but successful weight loss surgery is generally defined as maintaining a loss of at least 50% of excess weight 5 years after surgery. In addition, success is defined as effectively eliminating or reducing a patient's obesity-related health conditions.
At the time of my surgery, I weighed 275 pounds, and it took me a little under a year to lose 140 of that, and right now I weigh between 135-ish. So I lost half my person, and I also lost my blood pressure medication and gained a whole new lifestyle that wasn't available to me when I was morbidly obese.
Our definition of success is indeed the long-term results, maintaining weight loss is extremely important.
Certainly, weight loss surgery is intended to attack the weight, but the underlying reason why we're attacking the weight is to improve the diseases that go along with the obesity, referred to as the comorbidities of obesity. For myself, I was dealing with hypertension, I was dealing with the gastroesophageal reflux disease, the heartburn, I was dealing with probably some element of sleep apnea, and as well as the painful joints and feet. It was amazing to me to find that the number of things which resolved immediately following the surgery.
How successful has weight loss surgery been? Statistics for the gastric bypass Roux-en-Y procedure demonstrate that after 1 year, weight loss can average 77% of excess body weight. Studies show that with the vertical banded gastroplasty and gastric bypass Roux-en-Y procedures, excess weight loss of at least 50 to 60% has been maintained 10 to 14 years after surgery. More importantly, weight loss surgery improves your health. In a 2000 clinical study of 500 patients, 96% of the associated health conditions studied, such as back pain, sleep apnea, high blood pressure, diabetes, and depression, were resolved or improved after weight loss surgery. That's why the NIH has stated that weight loss surgery for the morbidly obese, when combined with behavior modification, is currently the most reliable and only choice for long-term maintenance of excess weight loss.
In our study of our first 500 patients, we counted up all the different health problems that our patients had. And out of a total of 500 patients, there were 1,752 health problems. In other words, several people had more than one.